Hello friends, myself Dr. Makan along with Dr. Sanjeev.
Hello friends.
Today we are going to discuss about the fissure in ano.
Yeah.
How can we diagnose and differentiate the fissure in ano from the internal bleeding piles?
Yeah. This is the anatomy of the anal canal. This is the anal canal and this is the dentate line. Internal piles always originate from the upper side of dentate line and external piles always below the dentate line and external side like anal verge toward the anal verge. What is fissure? Fissure is a deep longitudinal tear in anal canal which is below the dentate line, and deep tear is also we can say ulcer, which is called as non-healing wound. These symptoms
Actually, when we got bleeding in the perrectal area, we always find that we have piles, but it can be a fissure.
Yeah.
Fissure is a longitudinal cut below dentate line, longitudinal cut, and when it not heals, it can convert into chronic ulcer.
Yeah. Along with bleeding per rectum, there is severe pain which stay for long time after defecation or passing of stool. Second symptom is itching around the anal verge, and due to deep cut there is a spasm of sphincter muscles, and that leads to severe constipation. So there are four cardinal feature in fissure: deep cut along the longitudinal cut in the anal canal, pain which is very severe, and there is constipation. And if the fissure is chronic, then there is a skin tag like this, which we have discussed. You can see in this picture. There is longitudinal cut, there is redness, there is anal tag along with external piles. This is the external piles, this is the anal tag, and this is the deep longitudinal tear. If I am discuss about the fissure, there are two kinds of fissure: acute and chronic. In acute condition, there are all these symptoms which we have discussed, but in chronic condition, there is inflammation along with skin tag. Skin tag is not found in acute condition.
And when we observe skin tag, we always think that there is a pile.
Yeah.
But this is not a pile.
Yeah.
It is a chronic fissure with pile mass.
What is the common side like this? In this picture, this is the posterior side. 90% fissure always found in posterior side and 10% in anterior side, anterior midline side. Posterior side more common in males and anterior side more common in female. In female, because of lack of support of pelvic floor, and posterior side due to relative ischemia and curvature of
Relative
these.
ischemia is that the blood supply in the anterior part is more than the posterior side.
Yes. Last we are going to discuss about the treatment. For the treatment of fissure permanently, Chhar Sutra is the best therapy. In previous video we have all discussed about the how Chhar Sutra cure this disease permanently. So if you are suffering from